Welcome back. The doctors at Intermountain Health, the sponsors of this segment, want to stress how important it is to know the signs and symptoms of a stroke.
We stopped by their Horizons My Generation Clinic, that's senior focused care in Henderson, to learn more.
What is a stroke? Stroke is a term that physicians use to basically describe damage to the brain. This damage occurs due to blood flow issues. What happens when you have a stroke? There are several factors. The first factor being where in the brain the stroke occurs and how much of the brain has been affected. The second factor is time and length of the stroke. Time and length to treatment. Most patients will have 0 to no symptoms after a stroke. Some patients will have partial paralyzation, and some people will have speech difficulty. Stroke is the #1 cause of disability on the planet, and only 40% of Americans know how to even recognize, diagnose, and what to do for treatment for stroke. Here at Intermountain, we got an acronym, B FAST, okay? B for balance, coordination. Do you have any difficulties with balance and coordination? E, eyes. Do you have any deficits in one or both of your eyes? F, facial asymmetry. Do you have facial droop? A, arms, legs. Do you have any weakness in your extremities? S, speech. Do you have any speech difficulties? And T, time. How long have these symptoms been going on? The right way to treat a stroke depends on, first, what kind of stroke the patient is having. So it's very crucial that the patient get to the hospital as soon as possible. Once we get the patient to the hospital, we can do an MRI and a CT to determine what kind of stroke the patient is having. Something I want the patients to remember is that all patients should be able to recognize and diagnose stroke, because a stroke can happen at any time of any patient's life. That being said, there are some risk factors that can increase your risk of stroke. #1, hypertension, high blood pressure. #2, high cholesterol. #3, diabetes. #4, history of smoking. And #5, genetic factors. If you have any of the conditions we just talked about, you want to control these with medicines. If you have hypertension, keep your blood pressure under control. If you have diabetes, we want to keep that A1C level down. High cholesterol, take your statin medication, okay? If you have a history of smoking, stop smoking, okay? Other things you can do, lifestyle changes. If you're overweight, you want to lose weight, okay? Low salt diet, keep a balanced diet, preferably a Mediterranean one. One last thing I want the patients to know is about mini strokes, also known as transient ischemic attacks. These are basically stroke-like symptoms that last for seconds, minutes to an hour, and they totally resolve. Patients feel that because this is totally resolved, that they don't need to be evaluated. This is a mistake. Once you have a mini stroke, your risk of having a stroke increases dramatically, and this patient needs to be evaluated. The Intermountain Health team of specialists has developed protocols that shorten the amount of time it takes to diagnose and treat a stroke. This is important because a quick diagnosis and treatment can mean less long-term damage, less disability, and better overall outcomes.
Thank you to Intermountain Health for sponsoring this segment. For more information, visit intermountainnv.org.